all the dignitaries and luminaries who have joined on this session to be delivered by the master himself. So we start the ball rolling with a few words of encouragement from Dr. Himabindu Singh. Madam, you're unmuted, madam. Please unmute.
Yeah, very good evening. Really congratulate the West Bengal IAP and the AHA, who's doing wonderful job in spreading the awareness of adolescent health and capacity building of our pediatricians. Happy New Year first, and then happy Sankranti, and the festivities are still going on. Just we came from the Pedicon. All of us have met in large numbers there, and immediately we are ready with our academic activities. That shows the zeal of our IHA and IAP West Bengal, who's all charged up to do the Pedicon also next year. So with this, I'm sure that this year, being the Silver Jubilee year of AHA, we all of us have taken the commitment to spread adolescent health awareness throughout the country on youth wellness and with the capacity building on sexuality wellness, mental wellness, digital wellness, and metabolic wellness. MKC Nair sir, with your suggestions and under your leadership and advice, we have prepared the module also, and we had a TOT at Hyderabad, and we are looking forward for spreading this knowledge to our young adults in the schools and colleges over 100 cities.
Shilpi, please mute others. Shilpi, please mute others. Yes, madam. Go on, please.
Yeah. So I really congratulate Dr. Ashim.
Thank you, madam.
So you're
muted. You're muted again,
unmute yourself.
Yeah, I was just saying that I really congratulate the West Bengal IAP and AHA for taking up these activities at, especially today's topic, Dr. MKC Nair sir's adolescent counseling is so much in demand. Sir, the AHA has also taken a commitment to start a course on adolescent counseling. Last year, we have seen there was so much of demand by the members of IAP and AHA. So we are applying for adolescent counseling course under the ICP, the Indian College of Pediatricians. So we'll be again reaching out to you, sir, for your guidance. So I really wish all the best for today's program. I'm sure with sir being there as a stalwart for all of us, his sessions are so well attended. We need to learn a lot still from him. And I'm sure these sessions will benefit all of us. Again, thank you. All the best for today's session.
Thank you, man. Thank you, man. And now I go to Dr. Prashant Sawant, the CIP VP from East Zone. Dr. Prashant, please, a few words of encouragement.
Thank you, Dr. Ashim. Thank you for this your invitation, and really congratulations to AHA of West Bengal team and Dr. our Sukanta Dada, and thanks to Nair sir for agreeing and giving his time for all of us. You can see how encouraged and already more than 70 people have joined. That shows that how encouraging and how interesting the program is. And adolescent, really, it is a problem. Every day we listen and we hear and see in the print media, in the social media about the suicides and people taking other career options. And our doctors, they are struggling to how to do counseling, how to approach, where to start and where to end. So it's very, very important session. So I wish all the best and happy learning by our Guru of Gurus, MKC Nair sir.
Thank you, sir. Thank you, sir, for your kind words. I would now invite the immediate past chairperson, Madam Dr. Geeta Patil, to say a few words. Madam, please.
Thank you very much, Dr. Ashim Ghosh, sir. I think first thing, we know that we are very keen to listen to MKC, sir, because every counseling session is different and different aspect is already told in a simplified way. So Happy New Year, and I endorse Dr. Himabindu Madam's whatever she has talked. I think I wish all the best for the IAP-AHA team 2025 under the guidance of Himabindu Madam and her team, who will definitely do very well with her agenda and her mission and vision. And West Bengal, which was started that mission by Dr. Sukanta sir, now it has become like a big ocean. Now this year's team, Dr. Ashim Ghosh sir as a chairperson, Shilpi Madam as a secretary, Dr. Bholanath, and Santa Chattopadhyay as a joint secretary. They are definitely going to do very well. It shows that first session itself has been started, right session by Dr. MKC sir. What else is required for us? I won't take much time, but I think I have seen Preeti Galgali madam. She has to talk.
Yes. Absolutely, madam. And I'm inviting her just after you.
Thank you very much, sir, for giving me opportunity. Thank you.
Thank you, madam. And as Madam Dr. Geeta Patil said, next in line would be Madam Dr. Preeti Galagari. Madam, please. She's a VP from the South.
Before me, but maybe you would not have observed. Okay. Thank you, sir. Thank you.
Thank you.
Thank you so much, Dr. Ashim, for inviting me. It's a pleasure to be here. And West Bengal Academy is really very, very special to me because that's the place where I first started my presentation in adolescent medicine way back in 2005, and I presented my first paper in Adolescent at Kolkata. So thank you very much. This revives a lot of memories, and it's always a pleasure to listen to Sir. Sir is my favorite, as I've often said this, and whatever.
Yes, madam. I think her voice got lost. Thank you, madam, because she's busy in another meeting, in an international meeting. And I think we are not complete. Madam, would you be saying something?
I just wanted to say, sir is going to tell us how to first seek to understand and then to be understood, which is so important in adolescent medicine. And I think that is exactly what sir is going to tell us. And I'm really looking forward to his talk. Though I may not be there, I hope you will share the recording with me.
Absolutely.
Thank you so much.
We'll be doing it, madam. Thank you. And I would now invite our own Sukanta to say a few words, please.
Good evening. First of all, I must say that it's a great work Ashim has started for West Bengal AHA, because we have started the year by inviting a stalwart of adolescent health, who is guru of all gurus, as Prashant Shabud has already said. So we are all waiting for MKC Nair to speak and listening him, particularly on this very important topic. And the attendance already crossed 82, so it also indicates that our choice is without any wrong choice, I must say. No other person than MKC could talk on this particular topic. So I thank all the vice presidents who have joined here, and also all the chairpersons and ex-chairpersons, and particularly senior and junior members and those who have arranged it. I hope in this way AHA West Bengal will increase its academic activities and will ultimately progress further under the blessings of senior leaders like MKC and all others. And I'm waiting to listen, MKC. Thank you.
Thank you. And I think we would be wrapping up now. Just Dr. Prakash Arya as secretary, a few words. Prakash sir, as secretary of Central AHA.
Good evening to all esteemed members. What a great start of tenure of Team WBAHA 2025 with the inaugural presentation by one of the senior most faculty and Joint AHA Professor MKC Nair sir. I congratulate the team West Bengal AHA 2025, the chairperson Dr. Ashim Ghosh and his team for their successful tenure.
Thank you, sir.
Thank you, sir.
And WBAHA is holding this program in conjunction with WAP, and we've got the WAP president, Dr. Swapan Rai, to say a few words, please. Dr. Swapan Rai, please.
Good evening, everybody, and welcome to this endeavor by the WBAHA. So, in fact, I am also a fan of Dr. MKC Nair from 1999 when he first came in Howrah in the state Pericon, sir, if you remember. So, without wasting time, I am eager to listen to you, sir.
Thank you. After this brief introductory session, I've got the job of introducing the speaker, but I don't think I need to introduce the speaker. So many words has been said by so many luminaries. And I'm absolutely sure each and every one of us who are present on this platform today are indebted to this great man for learning the ABC of adolescent pediatrics. So without much ado, the stage is yours, sir.
Me do the screen sharing first.
Yes, sir, please.
Okay. So you can hear me well?
Absolutely.
Yes,
Sir.
yes.
Yes.
Yes, yes, sir.
So good evening to all the leaders of AHA, West Bengal, the National Vice President from East Zone, all the dignitaries, teachers, students, everybody. My first job is, I would like to say, we have completed 25 years. I remember in 2000, we started the adolescent chapter with Dr. Swadhi as chairperson and myself as secretary, with about a dozen members. Now we have grown so much. It is 25 years completed. We must talk slightly different. So we are going to start talking about young adults. Now you may ask a question, isn't the medicine people treating young adults? Yes, they are treating young adults, but they don't care for the young adults. We can care for the young adults, all their mental health or similar problems. We can manage. We don't have to be the physician per se, but still activities we can do much more, and that's the whole idea. Now, let me, before starting, let me say, I must give my regards to Dr. Dilip Mukherjee, who brought me to Calcutta 40 years ago and has been my best friend in Bengal. He's not well, I understand. I tried to talk to him 3 times, but somehow he was not able to. Please convey my message to Dilip Da, because that's a senior most person I know right now living in West Bengal. So that is one.
We'll do it. We'll do it, sir.
The topic I'm going to talk is little different. We are going to talk about, instead of adolescent, I'm going to use the word young adults, but almost the same. It's all the same. But I think slowly we must encroach onto the adolescent. I'll only show this picture just to say that a nation with a scientific temper, people of a nation who would be able to. What does it mean? It means this is Dr. C.N.R. Rao, who got only scientists, to best of my knowledge, who got Bharat Ratna. I think we should be proud of our scientists who have done excellent work, maybe in medicine or maybe in other areas. We must also be proud of our former president of India, Abdul Kalam sir, because he is the one who said the best brains of the nation may be found on the last benches of the classroom. What I'm trying to say is, I reciprocate what he said. All need not appear to be the most brilliant, but if you as a teacher can identify, or if you as a pediatrician can identify the little talents in those young people, then they will do great wonders. This is a very popular slide that I always try to show. It is saying that somebody had done a research saying all the great, all work, medicine, engineering, music, arts, everything together.
Sir, can I interrupt you?
We are not able to see your slide.
Yeah, you are not able to see the
no,
slide?
Sir. No, sir.
No?
Yes, no, sir. No.
Sir, Dr. Uday Bodhankar wants to say hello to you.
Namaste, sir. Thank you. Thank you, sir. What is the problem?
Thank you.
Start all over again?
No, sir.
No. You are seeing
slide,
the slide now?
definitely.
You are not seeing the slide?
No, sir.
No, not yet.
No, sir.
Then there is a problem.
Sir, you share the slides, sir. Share is
No,
only...
I shared the slide. Oh, let me go back. Let me go back. What happened?
Stop it and then
Yes,
start.
yes.
Yeah, you can go back
Yes.
and come again, sir.
No problem. No panic. We will do it.
Yes, it will be done.
What happened, I don't know. Because I had saved into the computer, then actually started it. I thought you were seeing the slide.
No.
I'll get it okay. Just wait a minute.
Yes, it's solid.
Meanwhile, I'll continue talking and getting my son to do that. Okay, so what we were talking was we need to talk about not only adolescents but also screen sharing.
नहीं उसके नीचे पढ़ो.
Let's go back. Screen sharing vanilla. Screen click click okay. Sharing click full screen.
Yes, sir.
Now we can see. Yes.
Make it full screen, sir. Then
Yeah.
it look better.
Is it okay?
It's full screen now.
Yes.
Absolutely.
No, yes.
Absolutely.
Okay.
Done.
So we will go back little bit.
Yeah.
No, I think this is okay. What I was trying to say is, there is a program called, I don't have to go back 2-3 slides. I can say what it is. As a Vice Chancellor of the Kerala University of Health Science, that's the first time I really took deeply from 14 to 19, worked for young adults. Now, what we did was student support and guidance program. Okay. And the fellow sitting next to me is a clinical psychologist who has extensive experience in doing such program. What we did is out of 324 colleges, we trained one male and one female teacher, and 250 units, 8 units were done. 50 of them probably didn't do much. And we trained 424 faculty, and we had 931 cases every year, nearly about 900 to 1,000 cases every year with problems. And what we used to do is, we, as a Vice Chancellor, myself will go to the district headquarters, talk to all the student guidance teachers, and do whatever is best for them. Now, another group, 14,000 students, we also talked about. I'm just skipping all this. After that, I'll come to the real topic. We looked at what are their problems in studies. And the most important that came, 85% was time management. Just keep that in mind, because for your own children, this is important. And second was 70% nearly note taking was extremely poor. So think of these two things, and textbook preparation, forget about it. 85% time management was poor, 70% note taking was poor. And these are the problems that we are talking: academic issues, general health issues, reproductive health issues, mental health issues, and substance abuse. I'm sure substance abuse may be more than this, but most people won't come talk about it. This is the counseling program that we do in the inauguration of the whole teacher training program. 2 teachers from all over the state. Now I will skip some of this because it is much more for college students. Okay. Now let's come to what are the issues. Number one issue that we talk about is the issue of undernutrition. I'm sure you are familiar with this card. We have been doing for last 30 years. All that you have to do is make the children take the height and weight. And when you take the height, only thing to remember is put the book like this against the wall, not like this. Most people do like this. Don't do like that. Take it like that. That's a simple point, but we need to do. Now coming to the subject of mental health. What are the things? We have so many mental health modules. We have so many books on mental health. But having said all this, what is most important is we need to have a simple way of doing. And using this method, I have got 1.5 lakh children from across the state. The data is going to be published. What we do? When a child come in front of you, you don't have time for mental health examination, mini mental health exam, nothing. And OP, when in your busy OP, you can't do all that. Just 3 things you have to concentrate. All of us we feel afraid, we all be sad, we may be anxious, all that is normal. It only means that we are alive. But if the symptoms are out of proportion to the cause, the symptoms are out of proportion to the cause, and the person has body symptoms, and then body symptoms are so severe that they avoid. There are many, many tools, but what I find so simple, just like Trivandrum scale, just 3 things you have to do it. What is it? Symptoms are out of proportion to the cause. It is not for 1 or 2 days. It is there for a few days. Then the person has body symptoms. What are the body symptoms? If it is anxiety, palpitation, sweating, etc. If it is depression, sleep is affected, appetite is affected, libido is affected. Now, when you talk about young adults, libido or sexual interest is important finding. For example, in a boy, it's so easy to diagnose. You just asking, have you been doing it? Yes, I was doing almost every day. Now, 6 months, no, nothing. Doing what means masturbation I'm talking about. So easily we can pick up in a boy, but a girl, it will be difficult. It will be difficult because difficult to ask like that also, as well as the frequency may be less. So, avoidance is not able to do routines. That means symptoms are out of proportion to the cause. You have definite body symptoms, and the body symptoms are severe enough that you avoid the thing. Let's look at this simple questionnaire. You may have 100 questionnaires, but I think this becomes the simplest. You only have to say, have you ever felt anxious, sad, blah, blah, blah. Do you feel that your symptoms are out of proportion to the cause? Do you frequently have any of the following symptoms? For example, palpitation, sweating. For the anxiety, appetite significantly less or more, sleep significantly less or more, sexual interest significantly less. Okay. Do the above symptoms disturb or affect your daily activities, whether it's job, studies, etc.? Then one more question, have you lost interest in things that you always enjoyed? Then 3 main things. You have to really talk about worthlessness. You are good for nothing. If a person says, often you feel that I am good for nothing, then take it seriously. There is no future for you, hopelessness. And then you can do nothing in life, a feeling of helplessness. If an adolescent have worthlessness, hopelessness, helplessness, don't ask anybody, it is depression. No way it can be anything else. And this is what I said, this is what we have proved in 1.5 lakh adolescents across the state, where each one from each from every panchayat, we have collected this systematic data. And what does it say? They all have if you have depression, worthlessness, hopelessness, helplessness. Once you have all the 3, then you start feeling life is not worth living and want to harm yourself. Okay? The suicidal tendency. This is all what a pediatrician need to do. You don't need to do more than that. You have a paper printed, keep it under your table, under the glass. And when a child comes, you just ask this, or ask them to, in local language, Bengali, you write this, and that's what I do. When you go to a school or college, you take copies of this and give to them. They will fill it up. And only you have to interpret if all the 3 are present. Now, a systematic study of how much is there anxiety, depression in the community. The study shows you have to do by scared, confirmed case had, you forget it. You have to screen by a tool called Scared, which we are doing every day. And what happens? The cutoff is different. International cutoff, the population, 500 adolescents in the community without any symptoms or anything. So that means they are just picked up from the community systematically by random sampling. And what did you get? Indian Scared cutoff, it was 25.8. DSM-4 criteria, it is 14.4. That means somewhere between 8.6 to 14.4, that means roughly about 15-16%. So I will confidently say 15 to 16% of children in the community do have anxiety and disorder, and we don't recognize. This is a published information. Then, do you have depression? Anxiety and depression go together. That is a very important message you must remember. And what happens, I still remember a child who came to me, who was, no sleep, very thin, absolutely at 16, 17 years, 20 kilogram, not at all eating, not at all sleeping, very disturbed child. In fact, I could not treat here. I sent to Dr. Paul Russell in Vellore. 4 weeks or 5 weeks, he was admitted, and the child came back with 40 kg and everything okay. And she finished her plus 2, 10th, plus 2, graduation, post-graduation. Now she is doing PhD. Last month she got married. First time for a student of mine or a patient of mine, I went for the marriage because it was so precious to me. And once she called me from somewhere, I asked her, where are you calling from? Geneva. What are you doing in Geneva? I was a team leader for Indian students. So you can imagine the change that can be brought by early identification. Another important case I will tell you, a nursing college when I visited, suddenly, I was some child, 4th year nursing student was going to be sent off home, discontinuing the course. I just told them, keep the parents out. Let me go talk to the principal. I talked for 5 minutes and I told her, you don't have to send off the child. All you have to do is give her 6 weeks leave and refer to her this psychiatrist who is very close by. And later, when I became vice chancellor, she came to me when I was giving the certificate. She said, do you remember me? So I said, Beta, have you stopped the drug? So immediately I did recognize, but I didn't want to show that I recognized because your patients don't try to do that. Now, what happened? Depression. 24% of adolescents with anxiety disorder also have depression. Get it clear. And more adolescents with anxiety disorder had multiple more disorders. And depression disorder is more severe among those with anxiety disorder. And as severity of anxiety disorder increase, severity of depression disorder also increase. All that been proved and published. So what is important is the message is very simple. If you have anxiety, you will have depression. If you have depression, you may also have anxiety. And what is the fun of it is both anxiety and depression has the same drug. So you don't have to use a different drug. I will come to that flow of setting. Now,
sir, I have a question, sir.
Yeah, please.
The in the newspaper, I've been seeing some news or the other where an adolescent commits suicide because not allowed a mobile or it was not. What is your take on these kind of adolescents? Are they missed cases or what do you think?
See, most of the suicide may have a underlying depression, and especially most of the drug abuse may have. But when it connected to mobile phone, it is a impulsive behavior. That's all. It may not be associated with the depression. It may be just an impulsive behavior. These children are very, very impulsive, and they may do it. That we can't do anything much about it, unless there's a system of interfering in the school or college. We can't do much about it. Whereas we can screen for depression, we can screen for anxiety. The fun is when you screen, you're opening a whole area to the child, a person whom they can trust and they can communicate. When I do this program in schools or colleges, it's not 5 or 6 children I see, maybe 200, 300 children I will see. I just distribute these 7 questions. They answer it. When they come back, everything is nil, or often not everything is nil, forget it. Don't have to ask them anything. But if 2 or 3 items are often, or if they have worthlessness, hopelessness, or helplessness, take any psychiatry book, comprehensive textbook of psychiatry. There is something not more important than this one. The book will give you 100 things, but a practitioner cannot do all that. That's why I summarize the whole thing into simple one. Okay. And in COVID had made situation very bad because again the studies. What are the 15 studies summary of 23,000 children, adolescents? They have behavior problems 79%, depression 41.7, 42%, anxiety 35%. Just look at it. Actually, I didn't believe it. Although it is a summary of 15 studies. So in the COVID period itself, we did a study with the help of UNICEF, and we found almost the same one. It was a very difficult study during COVID, but it was well conducted, and we found the same results. Now, let's come to the clinical aspect. Most of the children have some problem or other. The adolescent problems may be from childhood disorders that I must say From childhood, if he had ADHD, the lingering ADHD may be there. Child had contact, ODD, oppositional defiant disorder, it may progress to contact. So there is a whole group of disorders that was present in childhood, which may come into adolescence. That is one group. The second group, most important, would be something related to adolescent immaturity. So a whole lot of problems. And third is classical adult diseases like depression, anxiety, presenting earlier. And most of them will say the symptom actually started at class 8 or 9, but by the time they reach you, it may be class 12. By the time it's 12 and university and a common entrance exam comes, they are worried about it. And the second point I get maximum is after they have finished 12th, they are going for entrance coaching. And the entrance coaching is a center that really disturbs the child because they don't think of a person as a human being. Just a machine you put in, output should come. Put in, output should come. It won't happen. Whole lot of children either drop out or they come with these sort of complaints. So but for all this, we have three options. What are the three options? One is the counseling the child. Second option is drug therapy. We will discuss that. And third option is also a little bit of family counseling. I won't say family therapy, family counseling, because problem is with the parent. Just today I had a child who actually got into trouble because she was doing, she was telling me she was doing till class 10, she was doing this one, what do you call it? What is it? That physical activity like all that. And suddenly class 10 came, she was asked, stop everything. Most parents make this mistake. They play cricket, no cricket from now onwards. Class 10. No dance, nothing. What happened? This is the peak of emotional disturbance area. They need to love something. It may be music, it may be arts or something. Never stop. Even if you not start new, at least don't stop what is happening. And most of the children get into trouble because of that. Then, of course, on top of it, there will be love affair. So that also will complicate the issue. Now, let's talk about counseling. I will use three words. One is the advice, which is very old. If I advise somebody, then I'm talking about 40, 50 years ago, my college days. So that is not worth it. Guidance, second word. Guidance is what teachers and doctors do. You are professionals, lot of experience. Whatever you give, it is guidance is almost like directive counseling. You tell the person if you do this, it's likely to do well. They need not accept it. They are not bound to accept, but if they accept, they are going to get good results. And the third one is counseling. Now, what is counseling? Don't read all this. I will only say counseling is a learning process. Is preparing a person. You are not telling anything. Who tells? The counselor tell his or her problem. Counselor say the background of the problem. Counselor will identify the solutions, and all you have to do is help them to implement the solution. So three words is important. Affect, feeling, cognition, thinking, and connection. It may sound so simple, but you only need to remember three words. If I say something, then you may feel little offended. Okay, something bad I said. You may feel little offended. But how long you should be offended? 30 seconds. After that, you should not be offended. Why you are offended? Because you are going in the feeling pathway, affect pathway. All of us do that. Even very senior people, you say something, you get so offended. But after 30 seconds, you must recover and go into thinking pathway and say, did I say something wrong? If I said, I must say sorry. If not openly, at least in the mind. But if I didn't do anything, you say, go to hell. At least in the mind, you say, go to hell, I'm not bothered. So behavior is depending on whether you are taking affect pathway or cognitive pathway. That's the most important message I want to say. We all will take affect pathway, but prepare ourselves to shift to cognitive pathway. Second is, if there is a behavior, if there is a bad behavior, there is an antecedent, something that happening before, and there are consequences. Antecedents and consequences. When you discuss with the child, don't threaten the child, don't do this, that, and all. Just discuss with the child what is the consequence. If a girl is getting into sexual activity and all that, don't say this will happen, that will happen, post-coact will come, this come. Instead of that, you discuss with her understanding of what will happen. And suddenly you realize he probably doesn't know most of the things that we know. So we need to discuss. Never push the idea. That's the most important thing. Never push the idea with the child. Do not threaten the child. Do not say, I will tell the parents. Do not do any of this. All you have to tell is discuss with the child to understand what is her understanding, what is her feeling of it, and does she appreciate consequences? Is she prepared to take consequences? Okay. Now the counseling process, when you look at the counseling process, what are the positive steps? This is not in most books. I have made it myself. What is it? A positive relation building. Now, how do you make a relation? It depends on each child. It depends on each child. For example, of course, nothing to do with this. An autistic child who is not responding to you at all, if you tickle him the middle thigh, do, and they will start laughing. Try it out. Try it out. It really laugh. And so much so the child, when they come next time, they'll show the hand, do it, do it, do it. They'll come to do. So that means that is a technique. A child with autism, COVID days, what I found, we could not go very close to the child. So I used to tickle the feet of the child. And then ask the child also to do. She won't cooperate, but you rub against her fingers, at those toes. And what will happen? And then show a lot of drama. Oh, and all that. Then suddenly the child will think something interesting. So similarly, an adolescent girl or boy is very difficult because they won't open up to you at all. The girls will open up after 5 or 7 minutes once they feel confident about you. So few steps you have to do for relationship counseling. First of all, privacy is important, but privacy not to the extent of putting you into trouble later. So what I do is the mother will be sitting in front of close the door with the glass. Mother will be sitting in front of the thing. Just she can see what is happening, but she cannot hear what is happening. Ask the child herself to remove the curtain, draw the curtain. Not inside, draw away both ways so that it's all open. That's very important. But then once you create it, once you do this, child feel that you are looking at her protection. Then rapport building become easy. And then of course, ventilation or kathas. Ventilation means make the child talk. Never ask close-ended questions. Always ask open-ended questions. That means, did you have this feeling? She will say yes or no, mumble yes or no. Then finish. Then you have to come with the second question. Instead of that, you may ask, how did you feel about it? Can you describe what did you feel when such a thing happened? And she may or may not describe, but she will talk more words than single questions. And then the child, when they come, they have problems. What is the problem of a child coming for counseling, or they have mental issues? What are the problems? They don't have something called incongruence. INCONGRUENC. Congruence means I am supposed to be congruent, then only I can be a good counselor. That means my thought process, my thinking, feeling, and behavior, they go in a same line, same plane. You are at the same plane. You understand? Not perfectly, but almost. That is a good thing. So the counselor has to be congruent, but the counselee is incongruent. Their thinking is something, feeling is something, their behavior is something. So what we need to do is bring them into the congruent pathway. To make that, we cannot address 100 problems. They may be coming with 100 problems. So ask them to prioritize 3 problems. Once they prioritize 3, from that you take 1 problem at a time. Then one important thing is the context of the problem. In what context it happened? Is it an exam time? It is a home? It is a playground? It is somewhere. Because context is different for different persons. And the client's role in the problem. Most of us forget to ask, what is your role in creating the problem or solving the problem? So client's role should be recorded. That is important. Then solution, who will give the solution? The child has to offer the solution because he or she only know the problem. he or she only know the context in which it happened. So the problem solution also can be given only by them. Again, they may have so many solutions. Take 3 solutions, discuss with them pros and cons. What is the good part if you do like this? What is the bad thing that can happen? In the end, come to conclusion which one they will be doing that is feasible for them to do, and who should do the solution implementation. The help implement the solution. The client has to do the implementation, but you will be only helping them to do. It all sounds so complicated, but you spend few days with a counseling center, see how it has all been done. It becomes so simple, so easy. It's not so difficult at all, provided you have certain qualities. I will come to that. And then, of course, we need to terminate counseling. We need not go on with number of counseling. 7 maybe the 7 sessions may be the upper limit. Don't go beyond that. If you can't get results, refer to somebody. Nothing. Don't feel bad if you have to send somebody else. And 2 things can happen. I will tell you, warn you that. One is the child may get very attached to you. Okay? That getting attached to you is not a bad thing. It's called transference. This transference is what makes the child do whatever advice you give or whatever suggestion you do. They will do it perfectly because they have so much of attachment to you. How do the attachment come? Recently, last week, one child, 17-year-old girl, told me, "Sir, my mother was with me for last 17 years. She could not understand. And 10 minutes, you have understood me and my problem." It is just a professional relation. Mother, what is the problem with the mother? Mother cannot be detached. Mother gets so much emotional that she is not able to see the whole picture. They are so emotionally surcharged. Whereas the counselor is not emotional at all. Somebody else's child. Why should you get? If it is my child, I may get emotionally attached. But here, without emotion, as a third party, if you can look at it, you will be able to solve the problems. Now, effectively, counselors are, if you want to be a counselor, remember, every day you can't do counseling. So fix a day and time. All these children whom you see who needs little more counseling, you fix a day. It could be a Saturday because children, they have time, holidays and all that. You fix a time when you don't have a mobile phone, you don't have any other distraction, you don't have your regular patients. You fix a time, Saturday or Sunday, whenever is good for you. But it need to be a holiday because most parents won't be able to bring otherwise. And personally integrated and self-aware. You need to be integrated. That means you need to be congruent. Your feeling, thinking, and action should be on a same plane. Secondly, what is experiencing, what the client is experiencing, you should feel it. You have been in school, you have been in college. Even before I got any training in counseling, what I used to do is when a child comes, I just think of myself in that class. What was the problems I had? What was the thinking I had? What was my difficulties in that? You understand the children. Only difference is now children have gone so far ahead than us that they have more complicated things. That is something we need to. Their knowledge about everything is very different. The language they use, sometimes you may feel offended. How can they use such language? But then that is the common language they use at school. So don't get offended. Don't be a irritating grandfather. Don't be irritating father or mother. You just be normal child who can understand the child better. Identify the hidden shame. Unacknowledged, repressed, defended against. What happens is, in a depression child, what I almost always do is, particularly a girl, she may not look depressed. And if you say this child is depressed, the other people will say nonsense. How can he? She looks so happy, play, going on, all that. She may pretend to be like that. You just enjoy all that, fun that she is doing. But suddenly you ask, better, but why are you crying inside? Why are you crying inside? Why are you so much, in bad, this one, mood? Why are you crying inside? And suddenly the child will start actually crying. Then you know that child actually was pretending to be so happy because they don't like to be caught like that. Whereas adult is depressed, they will look depressed. Okay? Then, empathy we said. What is empathy? What is empathy? All of us have to have some empathy. When you have somebody's child brought to an acute emergency and they show all sort of nakras, you may get irritated at one end. But on the other end, just remember, middle of the night, you went to the casualty with your own child. Were you reasonable in behavior? Were you rational in thinking? Were you normal at that time? You behaved most unusual at that time. Just think that poor fellow, the parent also may be worried. At least you had some knowledge about the disease. They don't even know what the hell it is. So naturally, just understand. That is empathy. Put yourself in their shoes. Therapeutic relationship is a very, very important word. The relation that you have with a client is professional. Client or the mother is professional relationship. No other element can come there. It's a professional relationship. A professional means a person who has good knowledge, good skill, as well as good attitude. You cannot compromise on this. I'm warning you, if you are going to do adolescent counseling, make sure that your integrity is perfect. Okay? And you take precaution not to get into trouble, particularly the male. You should take a lot of precaution not to get into trouble. Of course, if your bad luck comes up, even then you may get into trouble. But by and large, you won't get into trouble if you take enough precaution. You talk to the child, girl, you talk to the mother, and get both of them on the board, then it may be easy. Okay. Next one, of course, they have suicidal behaviors in anxiety disorder. Now, this is a new information. We always associated suicide with depression. But this data clearly, published data clearly show, and the first author is Paul Russell. Okay? It's my data, but we wrote it together. So what does it mean? It means that anxiety can be a cause for suicide. That is why Preeti asked one question. I said it may be impulsive behavior. But under the impulsive behavior, there may be anxiety or depression. We know depression means they can go into suicide. But we don't realize, we were never taught that anxiety also can probably put presence of anxiety disorders and comorbid depression disorders significantly contributed to a high risk for suicidal behavior. That's very important. Then, when you have drug abuse, what do you say? You always say bad child, idiot fellow, poor upbringing, bad home, nothing of this sort. First, think of whether poor fellow is having depression or not. I'll tell you a classical example. A child, a boy, medical student, he was 5 years, he discontinued, came back. University said, if principal allow, we will allow. And principals are nothing doing. I am not responsible for all his drug addiction and all that. They came to me. I had to plead on their behalf to the principal, and she didn't listen to me. Then suddenly I took a trick of taking his daughter's name, who is in final year. I said, sir, it could be this. I took her name. And suddenly, he kept quiet for 2 minutes and then said, give me the paper, I'll sign. The reason is, it can happen to any one of us. I always tell people, when you act big, when you act as if you are the Lord and Master, just remember that one day you may have to go in front of somebody with the same problem which you have been abusing all the time. What a lousy upbringing, what a lousy parenting and all that. I used to give a lot of importance to my students, and somebody asked me, why are you so much giving importance to your students? I said, because 30 years down the line, I may go with my grandchild in front of him, and he or she may be the vice chancellor. Yes or no? Can it happen? It can happen. I said, then I should be prepared now only. Treat us so well that when you have to go there, they will get up. The vice chancellor will get up, not you, because they will remember what you have done for them. So that is something. As a doctor, this is the most important. I just give you an example. Recently, a lady from US called me. She said, I am 39 years old. Do you remember me? I said, he said, look, Malayali girl only, but lady only. So I said, how can I remember you, somebody in UK, US? She said, do you remember somebody you did blood exchange transfusion 3 times one night? I said, surely I remember. He said, it's me. She never called me till now. 39 years later, she is calling. That means somewhere along the line, that memory came to her, that you have done something good. That is important. Alcohol, of course, I'm not going to talk about all the drugs, but only thing is Childline India data says that this is actually 2018 data, 64% of patients coming from treatment were introduced drug at age less than 15 years. I think Preeti always talk about it. We had a module also prepared in Bangalore. I remember about drug abuse and all that. This message you should remember. Below 15 years, actual drug abuse start. So that is important. Then in the school or home, how do you recognize it? We know, we talk about needle prick, we know, talk about smell, this, that, and all that. Eyes red, so many symptoms we can talk about. But what is most important, if a child have lot of inattention, adolescent or young adult have inattention, irritability, anxiety, and suicidal ideation, before thinking of any other diagnosis, think of drug abuse. That is very important, because irritability means, it's the most important thing, irritability. Child is simply irritable. For what? There may be 100 other reasons, but think of drug abuse. That's the most important. Then let's come to drug. A psychiatrist taking class on this, they will give you so many drugs, because they are writing left and right, just like antibiotics. We won't talk about amoxicillin. We talk about many, many drugs and give you dosage, schedule, BD, TDS, QID, whatnot. And we get confused after the talk. What is important is the pediatrician need to do only 3 drugs. Okay, at least rather 2 drugs. Just get 2 drugs on your thing. One is fluoxetine. If it is anxiety, it is 10 to 40 milligram. In the pediatric age group, you can give, adolescent age group, up to 40 you can give. Adults, you may go even little higher. And if it is depression, same fluoxetine, 10 to 20 milligram is enough. Anxiety needs higher dose of fluoxetine, and depression needs only 10 to 20 milligram. This is not per kilogram, it's per day. Morning along with the breakfast. Okay? And somebody will say, will it increase the suicidal tendency? Wrong, wrong, wrong. 10 times you say it is wrong. Just like if you gave MMR vaccine, it will not produce autism. It's something like that. It is cemented in our head that MMR will produce autism. It's wrong. Just like that. But what happened? You still have to be little warning to the parent. What happens is, when you give the drug, the psychomotor things will become better. The apathy or psychomotor apathy will go away. So naturally, what happened? If you have a very severe depressed person, don't bother. He will never commit suicide. Our usual thinking, severe will commit suicide. No, he won't commit suicide because he doesn't have the energy. He look at the fan. It's like going to Himalayas. He said, I have to go to there, put the stool, table first, then tool, then I have to climb, do. Baba, I can't do all that. His psychomotor thing is so, body is so weak from that point that he cannot do all that. But the moment you give drug, what happens after 2 or 3 weeks drug, the depression will not go away. It takes at least 6 weeks, but your psychomotor thing will become better. So the child will be wanting to do it. So if you have suicidal ideation, child may commit suicide. So there is a data that on treatment, child has little higher chance for suicide, not because the drug induced suicide. Get it very clear. It is not the drug that produces suicide. It is just that when you give the drug, the child has little more. Okay, so that is the most important thing. You should not think of drug as the cause, but the drug, when you give drug, you have to give a warning that somebody need to be little careful, because there could be a slight increase, not because of the complication of drug, but because the depressive part comes much later. Okay. Then there's a second one is, of course, cognitive behavior. What is the knowledge on that? If you have all the time in the world and you have an excellent cognitive behavior therapist, it has been proved beyond doubt that both will give, the drug as well as cognitive behavior therapy will give the same results. Read me properly. If you have all the time in the world, the child and parent is willing to cooperate, and you have an expert cognitive behavior therapist, and you are willing to spend 6 months for this, you will have result. Now, instead of all that, if you give the drug for 6 weeks, child will be okay. Which one will you go by? That is the only problem. But in chronic cases, as well as some cases which doesn't, drug is only to get you out of the emergency situation. After that, to sustain the effect, you may need cognitive behavior therapy. What is cognitive behavior therapy? Very simple. It is operating on the cognition of the person. The adolescent is intelligent, their thinking is good. So what we need to do is, we need to promote that thinking. And what they have irrational, illogical, unrealistic thoughts. Just read that word, irrational, illogical, unrealistic thoughts. We have to convert that into rational, realistic thoughts. For example, the child went to the school, good morning, he said to the principal never responded. So what he will do? He will do one thing. See, my principal also doesn't bother about me. Principal may be busy with something else, but he will say it is my fault. So they have something called cognitive error. The error in thinking, that's called cognitive error. What are the errors in thinking? I not put the slide because the slide, it is coming there again. Too much it become. Overgeneralization. What is overgeneralization? Something went wrong. Suppose I charge, you didn't take a bath today. Just for joke, you might have said it. But a child will say, see, he also told I am not, that means I am not good looking, I am not clean, I am not perfect. Everything they try to do the negative. How can you find out in the OP? In a busy OP, how can you find out? Just ask the child, tell me 3 good things about you, 3 bad things about you. The child will give 3 bad things about you, but may not be able to give even 1 good thing. That's a screening test. You just ask for these things. If he cannot say anything good, that means he feel low, very low about himself. That's the most important. Then that is called maximization of negatives and minimization of positives. Good things they will make it a small, bad thing they make a mountain. So overgeneralization means if there's a problem in one area, they spread it to all the areas. There are a few things like arbitrary inference. You just make your own inference. But inference, you won't make it for positive side, you will make it for negative side. So this is called a cognitive, CBT cognitive triad. Negative views about yourself, negative views about the world or future, and negative views about the world. So what is the negative views about yourself? I am not good at doing anything. Okay, he may have failed in 1 or 2 things, but again say make it a mountain out of it. Then negative views about the future. I am never going to be successful. Just because you fail a class test, you don't have to make it so serious. And then negative views about the world. Nobody likes or cares about what I do. You need to have a free mind to get all this out from the child. Negative views about yourself, negative views about the future, negative views about the world. Then there is something. The other human relation, most important. Why human relation? The human relation, Lord Krishna was supposed to be the first counselor in the world. First counselor, counseling at, his best warrior. His warrior. So what is the Arjuna? So what is the counseling he had done? The Arjuna was a good warrior. He could do everything. He can do everything. But what happened when he see his teachers or his grandparents or relatives, he becomes so helpless that he can't take weapon. Arjuna says, Krishna said, you are not killing that person. You are killing only that body. That is your duty. Just do it. I won't go detailed because it's much more philosophical. I won't go into that. But what is the idea? Focus on love, compassion, devotion. Teach the child to love people, care for people, compassion. When something is going, he's a dog, it may be a cat, it may be something else. Why do you want to trouble them? Why don't you show some compassion and devotion to something? Devotion not only to God, devotion to your parents, devotion to your teachers. That's very important. Then assumptions of human relation. I won't go into all that because we want to have some discussion. So I won't go into that. But this is important. Boy-girl relationship. What is boy-girl relationship? Because love affair is the biggest problem that probably most adolescent pediatrician will see. Love affair is not a problem, but for us it's a problem. For the parents, even more problem. So what is the law of attraction? We are attracted to something which we difficult to get. If you get it easily, in fact, that is the reason why most love affair fail. What you literally had to go around wooing the girl to get a few minutes from her. Now, when your wife, she is available 24 hours a day, what to do? So then the craze will go away. And that is the biggest problem, law of attraction. Law of self-image. We are controlled by we see ourselves inwardly, act out the way we see ourselves outwardly. What does it mean? There is a two type of person within us. One is the inside person, other one is outside person. The law of different, boys and girls are different, not so. Different means their upbringing is different, their understanding is different, their concept of love is different. Boys are little more towards the sexual side, girls will be more towards caring side. So if you want to have a person, have a good relation, you don't keep on sending messages, I love you 20 times a day, he must be irritating fellow. But somebody who once in a while you got into trouble or you had some problem, he do everything without claiming any credit. Just do it for you and walk away. Probably there is a more trustworthy person. This is what you have to teach your children. Healthy boy relationship should be compassionate. Balance your relationship with other aspects of life. That boy is not the only thing. At that moment, he may be more important. But you can't forget your parents and other things. Honesty. Honesty means you have to be honest in your relation. Healthy relationship. Okay? Accept and be comfortable with what you have. That's the most important. Most of us are not comfortable with what we have. So accept and be comfortable with what you have. Respect, value, opinion, belief, and ideas of friend. Because you start owning the person. If a love affair goes for a few days, you start owning. I've had actually lack of time. I will get plenty of cases where the problem is such a good person. Person is not bad, but the moment you agreed for the love affair, he start owning you and he start behaving as if he is the master of everything. So ultimately I tell a girl, tell him on the face, go to hell. I don't need you, idiot. I don't need you. You just tell on the face. Because these people are sometimes, they will woo you for so many days, so many months. But after that, once you agree for something, suddenly they become this one. Unhealthy relationship, you look for physical abuse. If the partner push you, want you to do, hits you, do something which you don't want to do, undue control and humiliation. Do not tolerate any of this. And if they teach your adolescents or young adults, if they touch you, if they hit you, do something, that should be the end of it. No compromise on that. Because if you compromise once, whole life you will be compromising. Now, we have talked so much for adolescents or the young adults, but the parents also need something. Most of the time we are irritable, we are bad because we don't have good relationship. After some years, the first few years may be perfectly okay. First few months may be perfectly okay. Then your child comes, then you have respect for her, things may go. But after, what we used to call 7-year itch, now it is 3-year itch. You start having problem. Now, this I have made, it's a PhD project. Somebody had done a PhD with 48 items. I already picked up the 7 most important. Why this is important? Recently, we had a very, very VVIP man came from Delhi. He was looking at all my, scales, Trivandrum scale, all that. I said, sir, why you waste your time on that? You only need one scale. Have a look at it, and he took a mobile photo of that. What is this? Partner Assessment Scale Trivandrum. Actually, when you listen, you people can rate yourself. Don't tell anybody, just rate yourself. Whether your married life is happy or not. What is it? Reality. With all the good and bad in marriage, how do you rate? What is the overall rating? Above 50%, below 50%. With all the good and bad marriage, it is above 50% or 50%. Just put it, just write on a paper. You just write reality, above 50, below 50. You write it. Second, of course, is fantasy. Whether the partner fit in with your fantasy as a partner or your child or profession, all three. Does it fit in with you? You may be wanting to become a professor, but you didn't become. But forget about that. You are the most, lucrative practitioner in town. Most people admire you. What is your problem? So like that, you might want to be something, but you could not. So what? Be happy with what you have. That's the idea. Fantasy. Support. Maybe financial support, family support, or peer support, friend support. Professionals, biggest problem is professional, because of professional jealousy, you don't get peer support. That's very important. Okay. Then attitude, whether taking the concept of marriage seriously. Reme? I just hold for one. Sorry. So attitude, whether taking the concept of marriage seriously. If you take the concept of marriage seriously and you are not looking for somebody else, then naturally, even if there are minor problems, you tend to tolerate it. Then sexuality, this is very important. Sexuality, are you happy with your partner? Above 50, below 50. It is not the frequency, number, nothing we are talking about. You may be doing a lot, you may not be doing at all, but you could be still happy. So what is your happiness rate? Above 50%, below 50%. Then what type of person you are? Personality. Are you a giving type or a taking type? Most men are taking type. You want to take more and more, but if you become giving type, all your problems with the family relation will go away. What is a giving type person? Somebody who will go do anything in this world to make her happy, give her pleasure. And if you're talking about married people, naturally we talk about orgasm. Something the Indians are shy to talk about, but I think you should. Only if she get her that, then she can be happy. And if you are happy, then you will forget about many other things. Other inadequacies from your part. Because I always say, your wife's brother or father can give her everything in the world except one pleasure. That only the husband can do. If you can't do that, then you are not a good husband. Okay? Other way around also it works. For the female also. Last one is conflict. Whether problems are resolved amicably, not getting unduly upset. Most houses will have problem, but they also know how to get over that problem amicably without getting upset. So you just see how many above 50 you got, how many below 50. Actually, I made this for mothers of autistic children because they will be so badly affected with the diagnosis. On top of it, although they also have problem with the husband, then it becomes difficult. So every autistic child, we do this 7 items for the mother. Ideally, you should do also with the father, but some of these father very difficult to manage. They won't understand what the hell it is. So I don't do for them. Okay. I think it's the last slide, only 1 or 2 slides more. Okay. Okay, he has refused to move. I think it's time telling me to stop. Enough is enough. Okay, so I'll stop here and then we can have some question answer session. Because I covered everything I want to cover. There's one more thank you slide, that's all. Somehow it's not coming, so it's okay. Okay?
Okay. Yeah, it has come, sir.
It has come. It just come.
It has come.
Okay.
So please finish.
I'll take the next one. I'll take the next one. Okay. Just take this slide. What is a self-counseling? It's a new subject I'm working on, self-counseling. The reason is I have gone through hell trying to make the child development center. Every day has been a misery. But I never went to a psychologist or psychiatrist for counseling. I have gone to my cardiology friends to make sure echo is okay. You understand my point? That I have done many times to make sure that your heart is okay. but I never gone to for counseling. What I do was self-counseling. What is self? There are 10 rules for self-counseling. Number 1 is do not bluff to yourself, even if you may have to bluff to others. Very often as in the office, patient, all that, you may have to bluff to others sometimes. Don't make it a habit, but you may have to. But don't bluff to yourself. If you have done something wrong, acknowledge it. Before going to bed, you acknowledge that I did make a mistake today. I should not be doing again. That's the most important. Second, of course, you are not God. So you are likely to make mistake. Take precaution, precaution. Because don't ever think that I am okay, I am great, I can do this. Everybody, you are all human beings. We all can make mistake. So take precaution so that we won't get into trouble. Don't think others have to like you always. Now, the problem with today's youngsters are, they don't want the liking of their parents. They don't want liking of their, teachers. But somebody somewhere who comes in the name of some top film star girl, actually he may be a Buddha fellow, old fellow, but he'll be putting the name of some film star and they will be sending liking like that. So that is not required. Self-love. You start loving yourself first because you have so many good qualities. Caring and not love. That means in a love affair, I said it already, don't bother about the fellow who tell you morning. In marriage also saying, you don't have to tell morning, evening, all that time that you love you. No. But you show caring frequently, that you care for her. That is very important. Then conflict situation. Think of what she has done for you. You understood what it means? Remember that what your partner has done for you. Before getting angry and start using words. Not only partner, your friend. What they have done for you. Don't forget. Okay? Refuse to take insult. I said it. First 30 seconds, it may be emotion. But after that, you get into cognitive pathway and say, if I made a mistake, say sorry. Say sorry. I have said maximum number of sorry to my grandchild because I want to teach her to say sorry. If grandpa can tell sorry, she also can tell the sorry. I said, okay, beta, I was little bad mood. I'm so sorry. So she understands that it's okay. Anybody can get bad mood. Then think of other person's point of view. Be a third party. Don't keep on stubborn. Some of the teachers are so stubborn. Only I am right. Nobody else is right. How can it be? Damn it. Others also will be right. Just listen to it. Don't ever tell a child, I don't want to listen to you. You are bad. Okay, how can you are judge or what? Even the judge will not make such a statement. He will listen to both sides. Think of a judge. Ultimately, whatever decision comes, it is after hearing both persons. And 90% of the time, or at least 80% of the time, they will be giving good judgment. 10%, they also could make a mistake. Don't think others are lesser than you. This is a very important point. We all have this habit. Others are lesser than you. If it is a nurse, doctor will think nurse is lesser than you. Nurse will think the other nursing assistant is lesser than you. Nursing assistant will say attender is lesser than you. And attender will say the dog going around is lesser than you. Everybody is trying to find somebody lesser than you. No, they are all human beings. They are all human beings. This life, we became a doctor. Next life, we may be a kutta also. Why don't you remember that? Every time you kick a dog, remember next life, somebody will be kicking you because you will be a dog, born as a dog. Do not hurt someone if possible. Do not hurt yourself ever. What it means is, if possible, don't hurt somebody by words or deeds. And you don't hurt yourself. Particularly the daughters, you must teach them not to get hurt because the boy will say, if you don't agree, I will do like this. If you say, I will commit suicide, say, you can go and commit. If not for today, something else you will do. Might as well do it. Finish it off. Get rid of. Today, actually, I told this and somebody told me, so somebody has done like this. The girl told a boy, he actually went and commit suicide. She was scared whether that will become a case that she was responsible for death. No, nothing like that. Children don't become. Last one is, I am the custodian of my mind, body, and spirit. This is something you should teach them. I am the custodian of my mind, body, and spirit. I will protect, preserve, and enhance it. No, I won't give love to any donkey coming on the way. I won't give my body to anybody. I won't and give my mind. Mind means we all have certain belief systems. Okay? We have a right to keep our rituals, belief, all that. So long as it is not against somebody. That is important. We cannot have a belief which is against somebody. So long as it's not hurting somebody else's, we all have the right to keep all this, leave this. And this is the last slide. This is what we did before I left. Made sure that 285 colleges had this program. And I thought it was very helpful. And the new Vice Chancellor actually called me to revive the program. I went for that, came back. That's the time I fell down and had a problem with the, a stent in ICU for the first time in life. Okay. So thank you very much. This is a new child development center I have made in a remote area village. 5 years now we are doing so well. Thank you. Thank you very much.
Thank you, sir. Please, if you can stop sharing.
Yeah.
So after this absolutely mesmerizing talk by the master, in fact, we had touched a century of participants in today's webinar. So it was a great start for WBAHA. And I'm very grateful to acknowledge the presence of the following dignitaries whom we had missed during the introductory session. I take this opportunity to acknowledge the presence of Dr. Sudhir Misra and Dr. Chandramohan, both being EBs of AHA from the East, Dr. R.N. Mishra, the ex-secretary of Central AHA, Dr. Sneha Gajendrakarkar, the treasurer of Central AHA, Dr. Shomi Ghosh, the joint secretary of Central AHA, Dr. Kripashendu Chatterjee, the president-elect of WBAP, and Dr. Kalpana Dotto, the EB from the West Bengal. And lastly, I welcome Dr. Shushma Desai, the chairperson-elect, and I would ask Madam to say a few words, please. Madam, Dr. Shushma Desai.
Sir, good evening, sir. It was an excellent talk as expected. And of course, I wanted to learn self-counseling from you, and I was so very fortunate to learn it in depth today. And of course, learning from the guru of gurus is a different experience and excellent. No words to explain, sir. Thank you so much. Thank you, Dr. Ashim, for inviting
Thank you.
me.
Thank you, madam.
Thank you very much, sir.
So I as desired by sir, I now open this session for questions and inputs. Please, if anybody has got any inputs.
I must say it's an excellent session, and it's always learning, and I kept with full attention without any what I should say diversion, and I'll try to practice it, of course, the way MKC has told us, and the questions might come after I practice it, and if I get some difficulties, then I'll put the questions, not now.
I'm still learning, sir. I started in 80. Now it's only 44 years of counseling. I started on 7th of 80. Even after 45 years, I am learning new things. So that always, we all will be students.
Yes.
Good evening, MKC Nair, sir. Good evening.
Please.
Good
Madam.
evening, everyone. Sir, I'm your student of PGDAP. 2
Okay.
years back, we cleared.
Yeah.
I'm Dr. Kusum Kalla from Jaipur,
Okay.
Rajasthan.
Okay.
Sir, I inquired from you many times about this counseling course. So, but I don't know when it will start. Sir, just my query that if we, if I want to...
Madam, I will tell you, Kerala University's that counseling course is still on. In fact, last 3 days I have been taking class for that. Tomorrow also I will be taking 4 days continuously. I will be taking class for that. But nowadays most people are not coming for that. Maybe because CDC. I'm not in CDC now, but CDC probably is not publicizing. Development neurology, we have 200, nearly 180 people or 200 people. Adolescent pediatrics also have over 170 people. But for this one, we had very few people. So the course, if you want a university degree, it is definitely certificate, not certificate, PG diploma, it is still available. But again, I understand the chapter is planned to do with ICP online course sort of, mostly online, which is more easy for pediatrician. We am game for that. Anytime you call me, I can be faculty.
Yeah, sir, I have one query that in our hospital, most of the corporate hospitals, there are clinical psychologists also nowadays. So, among them, how to start our adolescent counseling OPD? Actually, then we are asked that what extra we can do when clinical psychologists are there.
No,
So,
clinical psychologists have been taught this one. I'll tell you, 3 types of psychologists are there. Somebody who has done MSc psychology, has lot of theory but never seen a patient. Then you have clinical psychology who has done a lot of work in adults, psychiatry, mental health, psychiatry patient, not even mental health, except maybe Nimhans, Vellore or some few centers where adolescent psychiatry division is there. Otherwise, they have clearly no idea so much about adolescent psychiatry. They are very good. If I have a problem, I can go to them. Nothing wrong. But adolescent, they don't understand adolescent as much as pediatrician understand. So if we have, but at the same time, we should not be on a conflict or pathway.
that's
you
the
should
point,
get
sir.
along well. Appreciate them. I'll tell you one thing. Today, my psychologist was doing a paper. She was trying to teach CBT.
Yeah.
I was in a dilemma whether I should interfere or not interfere. Kept quiet for some time, then I had to interfere, and I said, "Madam, you have to look at differently. What was the problem? Problem, I'll tell you. She's a brilliant girl. There's no problem. But the point is, to explain every point, she'll bring a different example. In the end, you have 10 examples, you are confused. I said, Madam, you start with one example and work your way through. If you can't do it at home and then come. You understand my point? So even for teaching, this is important. You take one problem. One thing you take anxiety, one thing take you depression, one for this, that. Don't give. Just start with one thing and work how you can go ahead. So counseling, teaching counseling is also an art. You cannot just give example, 100 example and teach. Take one example, one thing, and work your way through the whole grill.
Thank you, sir. Thank you.
Okay.
Good evening, sir. This is Dr. Bajaj from Delhi.
Okay, sir.
I just wanted to thank you for an excellent talk, and probably I think that will be incorporated in our day-to-day working. My only question is the ethics versus law. If an adolescent girl of 15 years came to me and she cut her wrist, probably wanted to cut the radial artery, but it was my first encounter, and I just could guess it. Probably there is something wrong, although she pretended that because of some blade mishappening, it happened. She was brought by her mother. Then I just sent the mother out and just discussed the thing. She cried and told me her mother is always not talking to her and always saying bad words. It was a minor thing. I just did the dressing. Then I asked, what should we do next now? Because the thing is, if it is a really suicidal attempt, I am supposed to inform the police also as per the law. But as per the ethics, I am not supposed to tell anything. Then I counseled the mother for some time, telling her that this problem could have been aggravated. But the girl said that if she tells it to my father, I will be kicked out. So after
I'll answer quickly. This is a problem every pediatrician will face. Day in and day out. The policy is very simple. We have a POSCO Act.
Yes.
We need to be aware of it. In which 2 things you should have a second opinion. One is suicidal tendency. Second one, sexual abuse. The best way to handle this problem is don't handle yourself alone. Have a psychiatrist involved. If you are still bothered about it, you can't get somebody so friendly. Send you a hospital. Your headache will be over. At this point, your skin is more precious than saving the child's ego. You understand? If you say something, child will be in trouble. We know all that. But then, but other way around, The same parent will blame you if you didn't inform. So the best way I do is have a consultation with the psychiatrist.
So it will
Psychologist
be
will not be enough. Psychologist will not be enough. A psychiatrist has to be contacted.
Okay. It will be enough if I just refer the child to psychiatrist and just
Oh,
write.
perfect. But make sure that child reaches there somehow.
Okay. Okay. Thank you very much. Thank you very much, sir.
Okay. Thank you, sir. Thank you, sir.
Any other questions from anyone, please? Otherwise, we will be wrapping it up. Sir has had a long talk. I think nobody has any other questions after this session.
Okay.
So from West Bengal AHA, on behalf of West Bengal AHA, I sincerely thank Sir and all the dignitaries who had come today for a wonderful, exhilarating session on adolescent counseling. Thank you, everyone. In spite of the festival season, so many of you had come on this platform. And we hope to have many more programs. Thank you so much. Thank you.
I'm sneezing because my wife is cooking my dinner. And probably she has something very hot and all that.
Absolutely.
I can smell it. I can smell it. That's why I'm having this.
So you can have that
thank
lovely
you. Good night, MKC, and enjoy the dinner. Thank you for all the talks. We really enjoyed it.
Thank you. I have a special affection for Calcutta and West Bengal because my younger days, I have spent much more time. Like people who are Rombre, there's most part of West Bengal I have gone. Because now, of course, I don't travel, but I have gone there. And Sukanto,
yes.
After Dilip Mukherjee, Sukanto has been my greatest pal.
Yes.
Again, I'm saying, kindly, Sukanto, make it a point to see Dilip Mukherjee sir and give my this thing. Just inquire about it.
Yes. I talked to him maybe 10 days back. I'll definitely call him. He is
on the
not,
phone, he is not able to answer properly.
Yes. That's he is not able to hear also properly and also not sometimes able to comprehend and give proper answer. But I'll convey definitely.
Okay, sir. Thank you all very much. Good night.
Thank you.
Thank you,
sir. And thank you, everyone.
Good night.
Good night. Namaste. Thank you.
Good night, everyone. Thank you.
Thank you.
Thank you, sir.